We are starting a series on the ergonomics in dentistry. So this is the first lecture of that series. Actually, I have seen certain questions which are being posted recently about the position of the dentist, then about the different working places like 12 o'clock position and the 9 o'clock position, etc., etc. So another question was about the position of the assistant. So I have made this lecture and let's start with it. This lecture is about the position of the dental assistant or dental nurse. Well, dental nurse and or the dental assistant, they are very integral part of the four-handed dentistry. Well, we need to provide them a more comfortable, less exhausting, stable, more accurate, and more efficient treatment to our patient. That is why we should be having our either a dental assistant or in some parts of the world they are known as the dental nurse. Their seating position. Actually, the question was about that. Optimal assistant seating allows easier access and proximity to the patient. The assistant should be seated on a stool so that eyes are 15 to 20 centimeter higher than the dentist's eye. This is the recommended position by the FDI, and we have to follow that. The stool should have a foot support to allow the assistant to work both within and out of the oral cavity. Should be having a foot support. This position reduces fatigue and stressful postures, stabilizes the suction, enables the assistant to properly hand over instruments to the dentist, and exerts the least amount of force on the patient's soft tissue or lips, like the soft tissues, lips and tongue. For a right-handed dentist, the assistant sits on the left side facing the dentist and vice versa for the left-handed. The working area for the assistant at the cabinet or mobile cabinet should be located on their right-hand side. The dentist uses indirect visualization with a dental mirror to allow the assistant to achieve improved direct visualization to avoid an awkward posture. Advantage, like there are certain advantages of this position. The assistant does not interfere with the dentist moving between the 10 o'clock and 12 o'clock position. The operating field can be seen clearly. The assistant's hand can easily extend to the oral cavity. Necessary instruments can be easily handed over to the dentist. So over here, we are done with this lecture and this part of the ergonomics in the dentistry. And I have taken the help from the FDI's recommendations. So kindly follow FDI's recommendations while answering this type of questions.